Hi, my name is Shaylee Mosier, and I'm going to be talking about my Medicare and Medicaid brochure. What is Medicare? Medicare is a federally funded health insurance program. Criteria for carrying Medicare insurance includes being the age of 65 or older. People with certain disabilities which include less than 65 years old, can also be on Medicare. People with end-stage renal disease, ESRD, or in other words, requiring dialysis or a kidney transplant, are also qualifiable for Medicare. Um, there are different plans available and associated with Medicare. We hear about the different plans all the time at our clinic because based on the different plan that the patient's on can affect the cost and the care that they get, especially when it comes to prescription drug insurance. So Medicare Part A, coverage for inpatient hospital stays, hospice, skilled nursing facilities, home health agencies. The premium cost that I found is generally $437 on a month basis. This can be quite costly for elderly people who are not working and are just drawing their Social Security. It is quite costly for them to carry Medicare. No cost premiums can occur for those who have paid into Medicare taxes by working during their lifetime. It just depends on the person themselves if they do qualify for that no cost premium. Medicare Part B is coverage for doctors' services, outpatient care, different medical supplies, and preventative services. Generally, a lot of patients have Medicare Part A and also Medicare Part B insurance together. And together, having this together can help them be able to pay for not only inpatient but also outpatient services as well. Medicare Part D, this is an add-on service for prescription drug coverage. Premiums depend on the income. Higher incomes pay higher premium prices. Lots of people are on Medicare Part D in addition to their other Medicare plans, as well as if they are withdrawing that for a supplemental insurance based from if they're still drawing Blue Cross Blue Shield. But it can help pay for prescription drug services. Medicaid, what is Medicaid? Public health federal and state funded insurance, generally for low income people, pregnant women, children, elderly adults, and those with disabilities. The criteria to meet for Medicaid eligibility is based off of a modified adjusted gross income. The modified adjusted gross income is a part of the Affordable Care Act and determines whether or not a person's financial situation is low enough to qualify for Medicaid. There are different plans available. Pregnant women and children can receive Medicaid at no cost to them, depending on, like I said in the previous paragraph, depending on how much money mom makes. Each state determines their own benefits. This program is state and federally funded, so it is used by the people in the state of Kansas can decide whether or not they want to give certain premiums. It doesn't have to be the same in every state. Mandatory benefits versus optional benefits. Mandatory benefits: inpatient hospital services, outpatient services, physician services, laboratory and x-ray, and also home health care. They can also add on optional benefits, including prescription drugs, case management, physical and occupational therapy as well. The cost of coverage with Medicaid, out of cost is $75 or less, usually depending on the type of care that is being given. Prescription drugs, co-payments differ depending on the generic versus name brand medications. Non-emergent medical services, higher co-payments can occur if the ER determines that a person is in the emergency room with a non-life-threatening issue. The way the ER codes or sends this to their insurance can determine whether or not they're going to have to pay a higher copay for that visit. These are my references, and thank you very much for watching. Bye.